talking to Dr. Chris Pittman, Medical Director and CEO of Vein911, and give their office a call at 855-VEIN911 or visit vein911.com to schedule a free consultation and let him take a look at what he can do for you to get your legs looking at their best. So, Dr. Pittman, let's talk about the ease of these procedures. I mean, people are really coming in and going home without any discomfort.
Well, absolutely. The first thing, I don't sugarcoat anything, first of all. If it hurt or it was bad, I would tell people. But sincerely, we leave our black hood in the trunk of my car every day. No one's ever hit us, cussed, or left. Everything we do is non-surgical. As an interventional radiologist, we work on awake patients my entire career, so we have to be very, very good at anesthesia. I am almost never compared to a dentist, so I am much less stimulating than any dentist you're going to go to. Most people worry way too much about the initial procedure, and then they take a big sigh of relief and say, hey, this is no big deal.
Are people awake during the procedures? Do you put them under? I mean, how does that work?
Everybody's awake, but perhaps 5% of people would like to take what we call an anxiolytic or a medication.
Some people are just so nervous.
A happy pill.
They
want to take a happy pill, which is
that.
perfectly fine. But most people stop taking them because they realize that it's really just not a big deal. If you've ever given blood or had an IV, it is less stimulating than that.
Mm-hmm.
It is less. What we do, honestly, is less stimulating than
just
that.
a little pinch is all it feels.
Yeah.
When you give blood
do you
too.
send cameras into the veins to like help you work or anything like that? And if so, can the patients watch that?
A lot of people watch what I do on the ultrasound screen, and because I am a recovering assistant professor, actually I still am at the medical school, I'll talk them through. I'll make it a med student if they'd like. I mean, some people want their eyes screwed shut, like I probably would, but a lot of patients are lookers and they want to see what I'm doing, and I'm happy to narrate.
You ever joke around and be like, oh crap, I broke the vein?
Rarely.
I don't think that'd be a good idea to do.
Rarely, but we do have a ton of fun. I mean, honestly, the kind of fun we're having right now is exactly the same kind of demeanor that we have when we're doing our procedures. We're talking about where are you from, what do you like to do, what kind of work you do. The only thing missing is a cocktail, honestly, from our procedures. It's really, for most people, vast majority.
Do you have to use like a local anesthetic, like inject any shots in the legs or anything like that, or no?
The one thing they may feel is we use a needle the size of a hair shaft, literally the size of a head, your hair on your head, for that initial
puncture,
initial anesthetic. And we buffer our lidocaine, which shouldn't mean anything to your listeners, but basically it doesn't sting.
So it's basically no worse than getting a shot of Novocaine when you get in the tooth, and that's even
it's not even that bad. If
yeah,
anybody compares me to a dentist, no, I take that personally. We are nothing like a dentist.
He's an anti-dentite over there.
Yeah. So is Jamie.
It's easier than that.
Until recently.
Not until recently.
And I hear patients who've been to other places say, "Oh, they hurt me," or my friend said it really hurt. Well, I don't know how else to say it. They're amateurs. I mean, we just do not hurt people where we're at. No.